Hello and welcome back to 90 Seconds Healthcare. With you is Ellahham, cardiologist. I wanted to address atrial fibrillation. I'm asked socially and as a cardiologist about this topic very frequently. And I want to focus today on three aspects. What is atrial fibrillation? What causes it and why is it becoming more and more prevalent, more common? And how can we prevent clotting or stroke with atrial fibrillation? I'm not here to scare you at all. This is meant to be more of an educational video. Please consult your cardiologist or primary care physician or electrophysiologist for further information. This is meant to be more of an educational video. I'm a cardiologist, as I said already, from 90 Seconds Healthcare. If you like our videos, please hit the like button after subscribing and share. So, atrial fibrillation, the atria electricity is chaotic and disorganized. There is loss of coordinated atrial activity. There is loss of atrial mechanical function, because it's a lot of function that is useless. So it is, mechanically speaking, no mechanical function. There's a lot of chaotic movement. It's irregular and frequently is associated with rapid ventricular response, means the upper layer of the heart is moving too fast in a disorganized way, and the lower one, the ventricle, is going fast. This is an illustration. I hope it makes it more clear. The left is the normal atrial activity, normal sinus rhythm, and you can see how the sinoatrial node or the SA node, which is seen here in the right atrium, you can see that it's nicely giving away the electricity through the normal electrical pathways throughout the heart. When you look at the right side, to your right side, it says atrial fibrillation. There's abnormal electrical pathways. You see these circles that's making the whole heart moving in a way that's inefficient, disorganized, and rapid. This is an example of the normal conduction, and you can see how it's nicely spreading throughout the heart, and this is how it's supposed to be. This is now the irregular heart. It's not doing well at all, is it? So what's doing here, it's moving, but in a disorganized way, and there is chaos, rapid heart rate, dizziness, irregular heart rate, shortness of breath, chest pain, maybe even fainting or near fainting. So I think this is clear, and I'm sure you can understand this. This is the rapid rate of the atrial fibrillation on what we call electrocardiogram. All what I wanted you to know is the heart will typically be irregular, and it would be beating fast. What are the causes of atrial fibrillation? Non-cardiac causes are especially alcohol ingestion, diabetes, genetics, obesity, significant lung disease, sleep apnea, stop breathing at night, and thyroid disease. Cardiac causes: coronary artery disease, heart failure, hypertension, very importantly, primary electrical disorders, and valvular heart disease, especially leak or narrowing of the mitral valve, which is between the left atrium and the left ventricle. Iatrogenic, beta agonists, which we use for asthma, may cause this. Cardiac and non-cardiac surgery, excessive caffeine, whether it's from the soda, cola, etc., whether it's from the chocolate, the tea, especially the non-green tea, and coffee. Please remember, many of the coffee drinks that you have are really flavors with a lot of caffeine, and obviously smoking, which is very important, and then cold remedies, especially something like pseudoephedrine. Why is it becoming so prevalent? we are living to older age, because of systemic hypertension becoming more prevalent and heart failure, because of valvular heart disease, diabetes, and obesity. What is my focus today in the next very few minutes? We want to prevent stroke. We want to make sure that we are compliant, educated. If we feel our heart is irregular or have our doubts, or with the smartwatches and the smartphones, we have doubt. No big deal. Just go to your primary care physician. Seek attention to your cardiologist, electrophysiologist. If you have symptoms, your concerns, go to the emergency room. An ounce of prevention is better than anything else, as you know and as they say. So the goal is mostly education. But just be aware that atrial fibrillation could be associated with other cardiac conditions, could cause or lead to stroke if not anticoagulation use, like, we want to make the blood more thin, and if not diagnosed appropriately. If diagnosed appropriately, you are likely to do well. So the focus is we look at the rate, we make sure your heart rate is controlled, we prevent any clot from forming with your compliance, your education, your adherence, your mindfulness. And then discussions about rhythm control and other things are beyond the scope of this video. This is not to scare you, but to let you know and educate you. We don't want to have a clot in the patient's heart. This is the arrow showing a clot in the heart. And make sure we are taking good precaution, compliant, educated, mindful, seeking appropriate medical attention in the appropriate place. Again, we don't want to have a clot. So this is again reinforcing the same message, because we want to prevent stroke by all means. Again, this is CT scan and imaging of patients who are not compliant or not aware of atrial fibrillation and had a stroke. And my final slide is we want to optimize. We don't want to have bleeding. We don't want to have clot. How do we do that? By going to the appropriate physicians, primary or cardiologist or electrophysiologist, and they will do the necessary, and they will use evidence-based medicine to make appropriate decisions. They will keep you safe, heal you, be kind to you, and most importantly, from my other videos, nothing about me without me. Get you engaged in prevention, and if you already have atrial fibrillation, in preventing the complications of atrial fibrillation. With you was Dr. Samer Ellahham. The best is to prevent atrial fibrillation in the first place. But if this was not happening already, that is okay. Now we can prevent the complications of atrial fibrillation. And there are many measures that I did not discuss to address rate control, prevention of clotting and stroke, and even addressing what to do about atrial fibrillation in the first place. Thank you very much. If you like our videos with 90 seconds healthcare, please subscribe, please hit the like button and share. Stay safe. Thank you.